I'm Dr. Ross Zafonte, Senior Vice President, Medical Affairs, Research and Education at Spaulding Rehabilitation Hospital, Chief Physical Medicine Rehabilitation at Massachusetts General Hospital and Brigham and Women's Hospital. This is Staying Healthy with Mass General Brigham, Sport Concussions. A concussion is an external force that produces a transient neurologic deficit to the brain after some type of hit or injury. People ask, how do you know if you've had a concussion? A concussion is related to some external force, but it could be a loss of memory or a loss of consciousness, although that's not required. A headache, dizziness, lightheadedness, visual problems, problems with balance, problems with one's affect, or a sense of being foggy. One thing to be aware of is which sports have among the highest instances of concussion, and that is American-style football, ice hockey, rugby, and soccer. And in women, basketball and soccer. We have to look at that because the comparison between the two sexes is not equal. In other words, women have higher rates in soccer than men do. Everyone comes into a concussion with their own personal risk factors. So the way I've always thought about things is we have our issues of who we all are as people. We have an event, and then we have the post-injury events. So when we think about ourselves as people, we all have risks, and risks that play into any event. Among those for concussion are things like prior history of depression, possibly anxiety, a history of migraines, or attention deficit disorder. So among the things that we advise strongly for is when in doubt, sit it out, playing through symptomatology, playing with a headache after a concussive event, or dizziness, or not knowing what play or the score is, can be dangerous in many ways. There are rare, serious, and profound sequelae that can happen, and most importantly, there's a prolonging of the long-term recovery that can happen. So what we advise people is it's in their athletic career interest to remove themselves or for you to notice that about a teammate and report it. Here's one thing we do know that is of concern, and that is a clinical concern that if people are getting more and more concussions and they're getting more and more symptomatology with less and less force, that's the time to really think with your physician, with your care team, about how long you should continue to play and what those long-term risks might be. So among the things we think about in trying to deal with a concussion is one, let's take somebody immediately out of play when they are injured. Number two, a short period of rest. We've learned prolonged rest doesn't help, but a short period of rest might. There is some recent information that contiguous texting or phone use or graphics may be deleterious to people, certainly within the first 48 hours. Aerobic activity, when judged safe by your physician and other team, is something that can be helpful in the reparative process. Two additional things to mention are sleep and hydration. Early expert treatment of a series of symptoms seems to abate the duration of those symptoms. People often ask, can I take acetaminophen, and lots of it? And what we often tell them is that they can use things very episodically, here and there, far spaced out. But if they're using large amounts of acetaminophen, you can get into a very negative cycle, producing further headache and referred to as medication overuse headache. Some of the things that we can think about when we really consider how to prevent concussions are rules of the game, equipment-based factors, person-based factors, and strengthening-based factors. We have to consider on a contiguous basis updating what we know about the game risk for younger people, and the rule sets that are instituted. So among the things that we worry about with repeated injury, prolonged difficulty in returning to school, difficulty with return to social or other activities, there is evidence that repeated concussions, certainly in a more elite population of people, has been tied to longer-term neurodegenerative disease. That is mostly either in elite athletes or people with high levels of exposure, and less well demonstrated in those with lower levels of exposure. Among the sequelae that we've learned about, both in sport and non-sport related concussion, there's a reasonably high rate of depression afterwards, of anxiety, of sleep disturbance. And it may be that these two have an interaction term. Perhaps some susceptibility one might have. Perhaps the injury unveils some of that susceptibility. We do know that in non-sport related concussion, people have a reasonably high rate of depression over a number of months afterwards. The story for concussions is generally a good one. With proper recognition and proper treatment, the vast majority of people will recover quickly. And even those who get treatment somewhat later after can improve significantly. The critical element in sport-related concussion is reporting it early, and getting early focused treatment.